Chapter 15, the parasympathetic versus sympathetic divisions of the autonomic nervous system. The autonomic nervous system hierarchy. Your hypothalamus functions as your integration and command center. If you were comparing your autonomic nervous system to a company, your hypothalamus would function as the president. Your autonomic reflex center would function as your vice president. The autonomic reflex center regulates your blood pressure, heart rate, and body temperature, thus maintaining homeostasis. Your preganglionic and ganglionic neurons could be compared to your workers. These are the doers of maintaining your homeostasis. They would reply only to the autonomic reflex center and hypothalamus. Your hypothalamus functions as your integration and command system, as said before, but it also involves your emotions. Your brainstem is where your autonomic reflex centers are contained. Ganglion are bundles of nerves outside of the brain. Preganglionic neurons versus postganglionic neurons. Your preganglionic neurons have cell bodies that lie within the central nervous system, as in your brain and spinal cord. Your postganglionic neurons have cell bodies that lie within the autonomic ganglia. The divisions of the autonomic nervous system separate themselves into parasympathetic and sympathetic. Your parasympathetic maintains homeostasis when we are at rest. In other words, this is under conditions of rest or digest. Your sympathetic division functions to maintain homeostasis during stress or exercise. This is otherwise known as your flight or fight mechanism. These systems function very differently, but because of anatomical differences. However, they also have similarities. They typically both use a preganglionic neuron and a ganglionic neuron to innervate cardiac muscle, smooth muscle, or glands. Their anatomical differences include length of preganglionic and postganglionic axons. Sympathetic division has short preganglionic axons and long postganglionic axons. Your parasympathetic division has long preganglionic axons and short postganglionic axons. They also differ in number of preganglionic axon branches. Your parasympathetic division tends to have few branches, while your sympathetic has many more branches. Your sympathetic system may have more than 20, while your parasympathetic has less than 4. Another difference is in location of ganglia. Parasympathetic autonomic ganglia are either close to or within the effector. The effectors of your nervous system are muscles and glands. The sympathetic autonomic ganglia are relatively close to the spinal cord and are on either side of the spinal cord or anterior to the spinal cord. The parasympathetic division originates in the brain stem and S2 through S4 segments of the spinal cord. This is also referred to as your craniosacral division. The sympathetic division originates in the lateral horns of T1 through L2 segments of the spinal cord. This is known as your thoracolumbar segment. The parasympathetic division functions to bring homeostasis in conditions of rest and digest. The sympathetic division functions to bring your body to homeostasis in conditions of fight or flight. Your parasympathetic conserves energy and replenishes nutrient stores, while your sympathetic division increases alertness and metabolic activities. Your parasympathetic has long preganglionic axons, and your sympathetic has short preganglionic axons. Your parasympathetic has short postganglionic axons, and your sympathetic has long postganglionic axons.
This picture represents the postganglionic and preganglionic neurons, neural tracts that lead from the brain throughout the body to its connecting points. The postganglionic neurons help glands in the face to function, like your lacrimal gland and the parotid salivary gland. The preganglionic neurons help your vital organs to function, like your lungs and your small intestine. The postganglionic neurons branch off from the preganglionic neurons.
Thanks for watching.